Hello, hi, I'm Dr. Arshad Vahabzadeh, and I'm here at the Digital Health and Fitness Live Studio by United Healthcare, and joining me is Daniel Kraft, who is a Stanford and Harvard trained physician, who is the faculty chair for medicine at Singularity University and the founder and chair of Exponential Medicine, an extraordinary conference series. Wonderful to have you here, Daniel.
Great to be here.
So you had a pretty extraordinary session on precision medicine just now. Really kind of got people excited. But let me ask a fundamental question. What does precision medicine mean to you?
Well, sort of the standard definition is precision medicine should mean when we treat our patients, we're using all their data, their genomics, other information, their environment, their place history to do precise prevention, diagnostics, and therapy. And in our session upstairs, we maybe want to redefine that even broader, particularly in the context of consumer health and all these connected and enabling devices. We want precise digital health. So not prescribing everyone the same wearable, the same user interface. You might need a different set of incentives and badges or points than I might do for my prevention or health, or to manage a chronic disease, whether it's diabetes or emphysema or psychiatric issue. So we broaden the spectrum of what's precision medicine in this exponential age of Internet of Things, coming to the Internet of Medicine. All these elements are creating a ton of data. How do we connect the dots between your microbiome, your genome, your digital footprint, and use that across the healthcare continuum?
And you're here at the Consumer Electronics Show. What kind of things are you seeing here that's making you think, wow, we're getting closer to this precision digital health, to this precision medicine?
Well, part of good healthcare, digital otherwise, is collecting data in smart ways, and most of us spend 99.99% of time outside of the clinic or being inside a hospital bed. So the ability of many of the technologies here often start on the consumer side, but are becoming medicalized. The blood pressure cuff in your watch, the ability now to track your sleep in smart ways, the connected homes and cars that can track your health, the ability now to connect and collect data in more precise ways, and now to make sense of that, to connect the dots by applying machine learning, AI, presenting that to the individual so they own their data, to their clinician who can make sense of it in a digestible form, is, I think, set to shift healthcare in a much more smart way from our sort of sick care model, intermittent and reactive sick care, to much more continuous data and more proactive healthcare.
What role do our patients have in terms of helping precision medicine develop and flourish?
Well, part of it is becoming engaged in their own health, not waiting to go to see you or I as their doctor telling them what to do, but now to track their own sleep and see when things are off and maybe bring that to their clinician. Check their EKG on their smartphone with an AliveCore and go, oh, there's something off here. Use that data to stay engaged in their information to help keep them on track, or if they have an issue, to stay on a therapeutic angle, and then to potentially be data donors, to crowdsource that data, to contribute to the future evolution of healthcare, whether it's your digital exhaust, your genomics, realizing if we all share, we can all gain something back. Just like when you share data with Google Maps or Waze, you can use that to bring us to a more precise era of health and medicine.
And your most exciting thing that you've seen here so far?
The most exciting thing I've seen so far here, one of the things I like, this whole blend of virtual and augmented reality and how that can be used for patients, for therapeutics, for pain management, for treating inflammatory bowel disease, to educate surgeons and doctors and nurses and patients. I think that is one of the hot things happening here, and as that melds, we'll use that for precise therapy. I'll give you the environment you need to be most chillaxed before your surgery, or to manage PTSD or beyond. So lots of potential there. And as we have more sensors in this whole internet of connected digital everything, we can apply that in smart ways as well.
Wonderful. Well, thank you very much for your time and your insights.
Well, and come check us out. Exponentialmedicine.com has a lot of new technologies crossing digital to omics to drones and robotics, all these things that we're seeing here that are starting to reinvent health and medicine.
Wonderful. I'm Dr. Arshad Vahabzadeh, and I'm reporting from the Digital Health and Fitness Live Studio by United Healthcare, and I'm with Daniel Kraft, Dr. Daniel Kraft.